what we do is we're taking questions. Preferentially, I'll take the GPP folks' questions, and then I'll do Facebook questions as well if we have a lull in the action. So if you have questions, submit them to the prompt either on the text for Google or the text for Facebook, and yeah, we'll go from there. So the good thing about the Facebook is that, hey, what's up, Serena? Long time no see. The good thing about this versus the Instagram thing is that it saves, and again, so I won't have to deal with the YouTube, because again, it's been trolling me all week. So, all right, so we will start doing questions. I did have a question earlier. This is unrelated to the GPP or thing, but it was related to training while pregnant, which I actually think is a super interesting issue, even though it should be a non-issue. So if you're in America, the American College of Obstetrics and Gynecology is like the go-to for all resources. And so if you were ever training a pregnant woman or coaching one, you should definitely go there and read up on certain milestones and certain do's and don'ts as far as supplementation, nutrition. Although I will freely admit that it's not a very great resource, and that should tell you something, is that there's not a lot of limitations for pregnant women. And so, especially for a training standpoint, in fact, if you look at their latest recommendations, there are no restrictions. So everything that you see online that's like, oh, don't go above 70%, or don't do barbell lifts, or don't do a Valsalva, or whatever, is not evidence-based at all. In fact, the evidence, if you really wanted to dig into it, suggests that weight training, particularly challenging stuff, makes labor go a little bit better, and this is especially true if they've been doing it prior to getting pregnant. Hey, thanks, Chad. What's up, buddy? Izzy's here. I think I like this Facebook thing too. It's cool. So again, yeah, if you're just joining the Facebook chat, you want to submit questions, you can do that. If you want to do the Google, if you're on my webinar group for the Barbell Medicine GPP template, then we can do questions through there as well. But to wrap the pregnancy thing up, in reality, there should be no restrictions unless there's something else going on, and this is assuming a healthy pregnancy. So no preeclampsia or like gestational hypertension or diabetes, in which case there may be some restrictions. But again, the evidence suggests that you could pretty much do anything. So that includes squats, bench press, deadlift, power clean, snatch. You could make the argument that doing burpees pregnant is probably not a good idea, but that's just from an anatomical standpoint. So Jeremy, good to see you, by the way, buddy. He asks, this is for the GPP question, or GPP folks. On week 4 of GPP, where it says deadlift 55% of 1 RM by 15 reps every 30 seconds. Is this 15 reps of the deadlift every 30 seconds? No, it's 1 rep every 30 seconds. So the idea is that 1 rep is going to be very technically sound and fast. It's basically a sub for power cleans. So if you were good at power cleans, your technique was very good with that, I would do power cleans instead. But a lot of folks really aren't able to train the power clean productively, either because they haven't dedicated enough time to do so, or because they have other functional limitations, whether they can't rack the bar very well, or they have some knee pain when they do it. So in fact, I would suggest if folks who do have regularly reoccurring knee pain and you're still power cleaning, you may consider eliminating that from the program unless you're getting paid to power clean. Because the idea, these are all training tools in order for you to be to gain strength, to be a better athlete, or to live life better. And if power cleans are beating the crap out of you, just due to the impact, you may consider removing those. I did an interview with Tommy Suggs a long time ago. I was writing this nutrition article, so I got to talk to him. I got to talk to Ed Cohn and Kurt Karwoski and Mike Teixeira and Lane Norton, actually. So it was going to be a good article. I'll comment later on why I couldn't actually write the article. But anyway, Tommy Suggs said, it was never the squats or the deadlifts or anything like that messed up his knees, but it was the dynamic power cleans and jerks especially. He said the jerks were the worst on his knees, just from the violence when you go to receive those lifts. So, which makes sense to me. So, in any event, I think, yeah. So hopefully that answers your question, Jeremy. Also, it's 7. It's a little after 7 here in now dark California. So it's okay to have a beverage with dinner. So the other question I got previously this week was how many reps should people be doing in their AMRAP sets? And you know, so now if you're moving on to week 4, next week, I believe it'll be gone. But the AMRAP stuff is really about building from week 1. So whatever you did on week 1, you should have done more on week 2, more on week 3, and then more on the final week. More reps, or you increase the weight and kept the reps about the same. So the idea is just progressive overload, and that's, you know, really the whole tenet of programming and coaching in general. So if whatever you're doing, whatever kind of programming you're doing, if you're not doing, if you don't happen to be doing the GPP template that I had laid out, it just has to get harder over time. So that's either more volume, more weight, or both. So Keith asks, how to train with a hip injury? Well, Keith, I'm gonna put you on the spot here. The hip's a big area, so where at in the hip are you having pain? Because actually, I had an MRI. I guess it was almost 2 weeks ago that showed I have a bilaterally torn labrum in my hip. I'm only was only symptomatic on my left side, so that's from an anatomical issue. But you know, the hip is a big area, so you may have something. Yeah. So you know, if you go and dig into the research on labral tears, surgical correction, for some folks, surgery is a good option. But if you look overall, it's not the best. Take these off. So the way I did it is for 2 weeks, I just did front squats and deadlifts from the rack versus from the floor. And basically it let the pain go away. And then I started back squatting. So the deal, you're gonna have to play with your stance and your toe angle a lot. And you know, your hip injury may not react like mine did. You can make it a case that most people with labral tears have decreased internal rotation, so you could make a case for spending some time working internal rotation. Another workaround, if none of that seems to help or make a difference, there are things called squat briefs. So basically, squat briefs are made out of either, you know, a single ply or a double ply, and powerlifters use them, or used to use them when you know, geared lifting was all the rage. But I found those to be a pretty excellent workaround because they do tend to take some stress off the hips. Another thing you could do, Ray-Ban actually makes a thing called warm-up pants, and those tend to be just like their knee sleeves. So you could order a smaller size and get a little extra support. So those would be my first kind of things. And if none of those seem to help, you may see an orthopedic surgeon, see what they have to say. And I would say no, that a STAR protocol not help, because so the STAR protocol, for those of you who don't know, if you tear a muscle belly, and the way you identify a torn muscle belly is you have a lot of bruising in the muscle, okay? Because muscles are very vascular. So when you tear a muscle, a lot of blood vessels get torn, and so you get a big bruise in the area. So, you know, if you go to the doctor and they say, oh, you tore a back muscle. So first off, no, you didn't, okay? Because muscles that tear tend to move at a high velocity over a long range of motion. And if anyone wants to tell me what muscle in your back moves over a long range of motion very quickly, I'd like to hear about it, and then I need to go get back and get my money back from my anatomy degree, because my master's in anatomy, they didn't teach me a muscle that moved over a long range of motion quickly in the back. So in any event, hamstring muscle, people can tear. Quadriceps muscle, people can tear. The STAR protocol is good for torn muscle. Basically makes sure that the scar tissue that's laying down is oriented in the correct area. But a labral tear doesn't really respond that way. Basically, a labral tear, you know, some people are asymptomatic with labral tears, is a defect in soft tissue, which is not, in you know, tendon and cartilage and synovium. And so irritating it with 5 sets of 20, which is what the STAR protocol is unlikely to work. So you tear a muscle belly. The STAR protocol suggests that 2 days later you go in and you do the movement where you tore the muscle on or that loads that muscle the most, and you do the empty bar for 5 sets of 20. All right, and then the next day you add 10 pounds to the bar and you do 5 sets of 20. You keep doing that until you get to a point where you need to drop the reps to fives. And the other idea is that you're not doing anything else that's taking away from your recovery. So I don't think the STAR protocol is appropriate for a labral tear. It's not really the right sort of injury, so to speak. Serena asks, would you ever recommend Ray-Bans with the patella opening? Probably not. And so the thing is, the Ray-Ban knee sleeves, which the original ones are the only ones worth buying if you had to make an argument. For them, they're only sold by Jackal's Gym, or at least they used to. I didn't see them on Rogue or another site, and I think it's because Jackal's has like a proprietary sort of relationship with them. But they're 7 millimeters thick. They're like $70 for a pair. All right. And in reality, I feel like they're outclassed by the SBD or the strong knee sleeve. And the strong knee sleeve is actually, I think, on par with the SBD. It just starts to smell a lot earlier than the SBD. So if I had one misgiving about the strong branded knee sleeves, I like that they're a little less expensive than the SBD, but they do start to smell a little bit earlier. HBP, you're gonna have to spell that out for me. Yeah, you can wash them weekly. Yeah, you can wash the knee sleeves weekly, and that's what I've turned to. Paul Horn, owner of Horn Strength and Conditioning, which in my opinion is the best place to train in Los Angeles if you're in for strength and conditioning, walked by my gym bag and he said, "Bro, what is that?" and happened to be my knee sleeves. So I am forever embarrassed. Okay, so high blood pressure. I don't know if many people abbreviate that as HBP, but we'll roll with it. High blood pressure, as far as training with it, exercise tends to make one of the biggest differences in lowering blood pressure. So you should do it. If your blood pressure is poorly controlled, you need to see a doctor about that. And make some lifestyle changes. And if you have other reasons for having high blood pressure, you address that. But training in general is probably one of the best things you could do. What are my thoughts on those who what are my thoughts for those who need to use a safety squat bar for training? That they should still squat. I had to do that for a while. A lot of my training was safety squat bar. That's fine. I mean, I don't prefer it to a straight bar, but it's fine. I guess the question would really be, why do you need to use a safety squat bar? Did you have shoulder surgery, or you have upper limb injury, something like that? Strong sleeves or the slingshot knee sleeves, they're the same to me. They're the strong knee sleeves made by the same company. So I think the strong ones are 9 millimeters thick and the slingshots are 7 millimeters, and the length of them is different. But both of them are reasonably good products. They just start to smell. And, I don't want to be that guy. Or maybe I do. I don't know. What else we got, folks? Nelson asks, what kind of training setup would you recommend for somebody dealing with a slat tear and elbow pain that seems to be exacerbated by frequent benching, pressing during the week? With 1 time a week, the pain is tolerable, so if you bench once a week, and resolved prior to the next pressing session. But progress has been slow. I have not I tore my both pecs rather recently. So I have dealt with that. But I guess the bigger thing is if you can only bench press once per week without having symptoms of elbow pain or shoulder pain that would otherwise affect your training, then you just have to accept that you can only bench press once, which is fine. I would just press twice per week on average. Especially for the novice progression, I would just press twice. And as you get towards the end of your novice progression, you may only be able to go up and weight once per week. After that, I think you should try to find a different way to press. If it's a incline bench, that's acceptable, or you just press twice. or you can dumbbell bench press or incline press. I mean, these are all compromises. I wouldn't say any of these things are optimal, but in fairness, if you can't do something, then making a compromise is better than just not doing anything. Does that make sense? So I think what you'll find is that you'll be able to press twice a week and bench once a week for a while. That's what I would do. Hopefully that makes sense. Strong, Craig asks, it was asked on the forum, for carbs, is 50% peri-workout, 15% carb for breakfast, and the remaining spread throughout remaining meals. Yeah, that's a good way to swing it. If you're going to eat multiple meals per day, four meals a day or so. Yeah, that's totally fine. Folks, if you're on Facebook, thanks for tuning in. Again, this is the first time I've done Facebook Live. Not terribly sure how this works, except for I can see you guys ask questions. And I like it. So, the question is, yeah, Zach asks, is eating twice a day a viable option? Well, sure, it's viable. And, a lot of people, including myself, if you put a gun to my head, are going to say eating multiple meals per day is likely better for a muscle protein synthesis standpoint. The deal is, I'm not sure if that's actually true. Only because, the evidence and the studies haven't really been done well enough to support that. And so, we have this theoretical idea that if you stimulate muscle protein synthesis more times throughout the day, that the sum of muscle protein synthesis is going to be greater for those who do it more often than those who do it less often. But we don't have data that shows that. And so, my feeling on it is this. You should probably eat multiple times per day, especially if you're trying to gain weight, because it'd be really hard to do it if you were eating twice a day. That being said, from a fat loss perspective, if you wanted to eat fewer meals per day, seems reasonable. I think from a performance standpoint, I can make a stronger argument to eating multiple times per day. And, I generally default to 4 times per day. That's generally how I operate, just based on my schedule. So, what are my thoughts on carb cycling? I think that it's overcomplicating the diet and has no real benefit, compared to somebody eating a non-carb cycle diet that's equivalent in macros and calories over a week, for instance. That being said, it may be useful in improving someone's compliance, which is overall good. So, does that make sense? Yeah, the idea is you don't need to complicate things, right? So complication without an objective improvement, I feel like that is where a lot of people would just get lost in the forest, and you don't need to do that. You don't need to really geek out on the timing or the amount of meals. Like, this is all like secondary and tertiary stuff compared to total caloric and macronutrient intake, and then your training. So I wouldn't geek out on that stuff, to be honest. Keith asks, he's building a home gym. My recommendations for must-have equipment. Okay, so look, here's the deal. So you need to spend money on a rack, a barbell, and then if you're a competitor, I can make the argument you should spend money on weights, calibrated weights, especially now that Rogue is making them and they're relatively affordable. They're about the same price as regular York iron, and York has, you can tell that it's a true York legacy plate because it has milling marks on the back from a mill that has basically shaved it down to the correct weight. They have pretty tight tolerances. I think it's 10 grams plus or minus, which is pretty tight compared to the 45-pound plates at a commercial gym or those huge bumpers in a CrossFit gym that nobody knows how much they weigh. The running joke is that CrossFitters continue to PR their lifts because the bumpers weigh different things at different gyms, and so they're like, oh, it's a PR. No, I mean, obviously there's a big push there to use the calibrated plates as well. So in any event, if you have a good rack, a good bar, a good plates, only other things I would recommend buying would be a good bench. Rogue has pretty much got that market covered. I think having a good pair of bumpers is a good idea. And then I also think that having An assault bike and a prowler would be pretty good. You can make the argument for a rower, but yeah, those would be my recommendations. Hey, I think my dad asked me a question. All right, so Stephanie asked, what are my thoughts on intermittent fasting? Yeah, I think it's a reasonable option. Some people really works with their lifestyle, and so if that makes them more compliant, then I'm all for it. I do think it compromises the ability to fuel training. I certainly wouldn't train fasted. It's not a good way to train. And if you're an athlete or trying to gain weight, it's very difficult to get all the food that you need without doing that. And I don't think that there are really any benefits to intermittent fasting outside of compliance. I think those have been overstated overall. My dad asks, this is great. Hey, quick question. Since my angioplasty, I'm on 75 milligrams of Plavix, not to allow accumulation of platelets in the area of concern, but my question has to do with my weight training, if there's anything you need to be careful of with Plavix and strength training. Zero. None. Easy question for my dad. He's sending me lobbers. The guy creates me, and then he sends me easy question. I love the guy. Eat a bagel, Sam asks, do you have any experience coaching people regularly taking Vyvanse or Adderall? Yes, I do. What is your question, Sam? Willie Moore is here. He is Willie, I think I just saw you clean and jerk. Was it 341, 350 something? I don't know. He's on the comeback, and it's obnoxious. So keep posting your videos, but also know that every time I don't like them, I saw them, and I'm just jealous. You've read intermittent fasting really messes up women hormonally. I think that's probably multifactorial. I wouldn't probably agree with that in general. I think that's probably. I mean, some people certainly are going to have abnormal reactions to people or to certain medications. But Denny Davis asks, what are my thoughts on frequency and volume for lifters in their 40s and 50s? It's actually a good question. So in general, people will say that older folks need to basically cut their volume down. They need to do less because they're older. My biggest, I think I disagree with that, just on balance. The idea is not that they need less volume, they need less intensity, which we can define as some percentage of 1 RM and at 1 rep max. And I think that's what really messes them up. So a true like 5 RM tends to really just, beat an older person up more than it does a younger person. And then to do 3 heavy sets of 5, at the end of their linear progression, that really kind of takes it out of them, and they need a longer time to recover. And so instead of doing less training, less sessions, I would just do the same amount of sessions with lowered intensity, and then have a longer interval between adding weight. So instead of 3 sets of 5 across that are real heavy, what I would do instead would be a little bit more moderate weight on 2 of the days, and then a heavier day, and then just kind of ride that out. So I think more volume, more training sessions in general is a good idea for most people. It's just how do you calculate and manage the fatigue? Those are the big things. So if you're managing fatigue with training is probably the biggest issue. So it'd be hard to say volume or intensity because they're intimately related. Denny, David, I just answered that. Lenny, where you been? I know. See, where's my dad been? He's probably asking, Jordan, where you been? Leela asks, hi, do you have a pre-workout that I recommend? Asking for a friend. No. Yeah, it's called Gains with 3 Z's, RX. And I just got a shipment notification that it's coming my way. So it should be live here in a couple of days. And I made it, so I think it's great. No, but seriously, I made it out of frustration because there's really not anything out there that I would recommend that's good pre-workout supplement that's turnkey, and that you don't have to add anything or dose it differently. But Keith, by the way, if you had a question on or Sam rather, about Vyvanse Adderall, like ask it, because I do have experience with that. So Keith asked websites that I recommend other than barbell medicine and starting strength. Oh, I mean, depends what you want. If you want to read stuff about fitness, there's a lot of stuff. I think you should read everything. Strength Theory is Knuckles' site. I think that's pretty, if you have time, you should definitely, his articles are pretty good. You should read Alan Aragon's stuff. You should read, um, you know, I think starting with those two, and then you should get outside the box and read more scientific type stuff. Because honestly, the stuff on training online is just, it's less good. Michael Mash has a pretty decent site with his PT stuff, and then my buddy who I went to college with does the Squat University, Aaron Horschig. It's pretty good. So you can check out all those. Lenora asks, thoughts on a 61-year-old woman competing in strongman? I mean, honestly, if you're 61 and competing in strongman, that's my hat's off to you. Cheers to you. I think, I normally push people towards powerlifting. One, because it's super accessible, in that, I mean, there's always a meet going around. The functional requirements of powerlifting are pretty low, and I think there's probably a lower injury potential than a strongman. That being said, you're 61, you're an adult, you can make the decisions. Zach Cooper. Dude, please, Zach, please tell me you don't work for Titan. Come on, man. Don't do that to me. Scott asks, what are my thoughts on taking apple cider vinegar with meals? I think that if you want your food to taste bad, you could take apple cider vinegar with meals. Leonard, my father, asks, I feel like he's trolling me. No, how about the return of James and Malcolm? Yeah, yes. So if you guys don't know, I'm like a rabid motocross, supercross fan, which is actually interesting when you think about from a training perspective, which we'll talk about it now. So these guys, like many other sports, prioritize aerobic endurance, which I don't understand. You have to have a decent aerobic base in order to fully express your anaerobic capacity. So that's 100% true. And you can make the argument that, they normally race 20 laps at a time for Supercross and 30 minutes plus 2 laps outdoors. And so, yes, certainly there's a huge aerobic demand, and they need to have a good base there. That being said, at some point, putting in tons and tons of mileage on a bicycle, which is what a lot of their training regimens revolve around, is detracting from their ability to practice their sport because it's accumulating so much fatigue. And I think a lot of them could end up being stronger and would be better riders for it. That being said, nobody is calling me up and asking me to train them for professional racing. The shift has seemed to be to ex-professional cyclists, and so it's no wonder why cycling is kind of being pushed as a de rigueur for these high-level motocross racers. Yeah, I agree. So most pre-workouts are, in fact, filled with junk. That's the issue. Roy, hey, what's up, buddy? Yeah, so Zach, you bring up a good point that liftinglarge.com and Anderson Powerlifting, they stock some Titan stuff. The deal with Titan is this: it's the quality. It's not good enough for them to be one of the premier powerlifting brands, but they paid the money, so hey, kudos to them. Top 3 to 4 supplements. Whey, if you're going to count it. Creatine monohydrate. The next would be betaine anhydrous or beta-alanine, depending on your sport, and caffeine. Yep. This is Makers 46, and yeah. So I had a day off today, so. Do I ever read Dinosaur Training? I did. I don't really like it. It's okay. Sam asks, let's see, negative side effects of Adderall or Vyvanse. So it is a stimulant, okay, but the biggest issues are going to have to do with your lack of appetite. But I mean, honestly, guys back in the 60s and 70s were doing speed to get up for workouts. So, and we're for Olympic weightlifting. So I think you're going to be okay. I think you're going to be all right. There you go. Put it in the back of the van. So Brendan, who is a professional motocross racer, asks, CrossFit for motocross. Yeah, so the deal. Hey, what's up, Amanda? The deal is CrossFit. I can't really define, right? So if we're talking about mixed modal conditioning, so you're using barbell, you're using prowler or rower or whatever. In general, that stuff is useful if you are previously untrained. Is it optimal for improving sports specific, or sorry, general fitness that can be applied specifically to your sport of motocross? I would say no. And the other thing is sort of time investment. So, CrossFit, you can go and do a workout. You don't have to plan anything because your coach is supposedly doing that for you, and you can get decent benefits out of that. But if you put a gun to my head and you said, what is the most optimal thing to do? I think you need to do strength training 2 to 3 days per week, mostly 3 days in the off season, 2 days during season, and then a significant part of your other training just needs to be monostructural training, which is on a rower, on a bike, running. And then a lot of your time needs to be spent on the bike. And it's the motocross bike. And the deal is, the higher skill the sport is, the more sensitive it is to practice, right? So motocross, you can have all the fitness in the world, but if you're not very good on the bike, you're not going to be very good at the races. And so I think a lot of people are trying to make up for skills that are missing with fitness. And I think obviously you need both. So if you're asking me, does CrossFit improve your fitness versus no training? The answer is yes. If you're asking me if CrossFit is more optimal than what I told you earlier, I would say no. So there you go. It's so funny, guys. If you're on Facebook, it's like a bar mitzvah over there. It's great. Oh man. Best exercises for a herniated thoracic disc. Well, Heather, that's an interesting question. So most people, most adults, particularly those over the age of 30 or 40, will have evidence of at least one herniated disc on an MRI that may or may not be symptomatic. So herniated disc is not a contraindication to strength training. If you have symptoms during the exercise, it would behoove you to see somebody to work around that. That being said, if you're not having symptoms, you just know that you have a herniated thoracic disc, you can barbell train, you can squat, you can bench, you can deadlift, press, do all sorts of things. The biggest, my sort of biggest selling point towards strength training, even in the face of a herniated disc, is that if you want to protect your back, you need to have a strong back. A stronger back is only created via strength training, okay? All the functional stuff that doesn't actually make you stronger, and strength is the production of force against an external resistance, is, it might make you work hard, but it doesn't make you stronger, and it may be, kind of a waste of time. If you have numbness and tingling, yeah, but if it's a non-surgical thing, yeah. So in general, it'll settle down, it'll go away in general, and you should train. You may need to take some weight off the bar for a while, and definitely would help you to see a coach just to rule out any sort of exercise-induced sort of cause. But yeah, in general, that'll go away. If you have numbness and tingling down your leg, where it's getting worse, those are red flag signs for sure, and that would be referral to the emergency department. So, well, hard to do a lot here on Facebook with the diagnosis, but yeah. Interesting stuff. So we'll take more questions. Otherwise, I'll have to go back to the email. We've been getting a ton of emails about people wanting to get out of their conditioning, or like why they should do conditioning while they're strength training. And come back. St. Louis is where I'm from, but I think I've left St. Louis for good. Joel asks if I ever program the prowler in the novice progression. Yeah, so the issue with conditioning if you're a novice is that you are if you're a novice, by definition, a small amount of stress, which you accumulate over a single training session, is enough to cause that stress recovery adaptation cycle, okay, which doesn't happen for intermediates or advanced lifters. You have to do it over multiple sessions. So then, if you add another exercise or a sufficiently stressful training event like the prowler, you can, mess that up enough where you end somebody's LP. Who should do the prowler for if they're a novice? And I would say those who are really trying to lose weight and who that's appropriate for. So if you're very overweight and you're doing novice linear progression, then sure, doing the prowler, you're making compromises already, which is fine because the ultimate goal is to lose weight, so you can do the prowler. But anybody else who's not, in that sort of demographic, I wouldn't have them do the prowler. Even if you're, a little overweight or whatever, I probably would just hold off on that until after the novice progression so you don't ruin that chance to get really, really strong really, really quickly. Stephanie asks, multi-day. Yeah, so you're doing the ruck, she's doing the ruck, go ruck stuff. So later this year, you hope to do a 48-hour race with limited food. That's wild. What do I suggest to help? Yeah, so one of the things I have people do for like endurance events, I'll actually plan in fatigued runs, and I can do the fatigued runs or endurance work a couple different ways. One, I can make them do it 2 a day, and so the second session is a pre-fatigued session. Two, I can make them do it fasted. So we know that fueling beforehand tends to improve performance, but if you do it fasted, that tends to be in a fatigued state. And it basically gets you a little bit better at using the resources in your body for fuel in an acute state. Now, don't misunderstand that and say that you're going to burn more fat if you do fasted cardio, because that's not been the case. But for endurance athletes, there may be some benefit at the end of a long race or for a race where you're not going to get fueling to kind of train that. So it shouldn't be a priority endurance training event. The intensity should not be terribly high, but yeah, those can be beneficial. Serena asks, sled over the prowler. They're the same. They're the same. I have no better or worse. Keith asks, for joint injuries, kill inflammation pain first and then train, or train through the pain? Depends what kind of injury, Keith. Depends what kind of injury. Craig asks, not doing conditioning during during GPP seems very counterintuitive. I know. So the thing is, the way I look at it is that I'm going to mostly tell people not to do conditioning if they're trying to get real strong, or not to do a lot of conditioning, especially if they're not previously exposed to that sort of thing. But during a GPP phase, I'm allowing them to do conditioning. Just do it. Just do it. Just get in good shape. Yeah, doesn't matter what order you do that stuff in, though, Craig. Do whatever. Just get it done. Hey, it's the lighting. It's the lighting. Mark Weiser is here. Hey, Mark. I was tooling around A1, and I didn't see you, buddy. I know you were there. Or at least I know you were at San Diego. But I will be at Anaheim this weekend. So if you're there, I'll see you there, buddy. Yeah, so people do ask, though, why do conditioning even for strength work? And a lot of it is to mostly either maintain or try to slightly improve somebody's work capacity while they're training, particularly when the volume is higher. That's one thing that I use it for, and the other is obviously for weight control. So, worst thing about California, cost of living. Easy. That's an easy answer. Dude, yeah. I'd love to come down and hang out, buddy. I'm on call on Saturday, so I get out about 6:30, so then I'll be trying to hustle down to make the night show. But, yeah, man. I'll be down there. Repping the 619. Yeah, Pops, you gotta fly in, bro? Come on, man. Mark, are you ordering a pizza? Be honest. I was waiting to see you order another pizza, because last time... Not today. Ness is in the house. So we are taking questions. If you're on Facebook and you're liking what we're doing, give it a like. I think it bumps it up to like the top of the page or something. Also, if you're watching this and it's tomorrow and it's not live, because it does save it, you can ask questions and I may answer them in another video or talk about them next webinar I do. So I appreciate the folks interacting. It's very good. Mark Stanwyck is in the house. He helped design the new Barbell Medicine website. So I've been getting a lot of emails this week about some of my links being down that have been posted elsewhere. They're not down, they're just the website changed. So I'll have to go find all these links and redo them. Or not, or you guys can just look. Let's talk about... Well, first, if anybody has another question. Craig's got a question. Any luck with getting webinars on YouTube? Yeah, so I just made a new YouTube account called Barbell Medicine, and so far the length of the videos have not been accepted, or the format I'm trying to do it. So I'm still working on that, because I do think in this day and age, people are consuming information via video and sound bites and stuff like that, so I need to be on the tubes. Donuts with the Doctor. Yeah, I think that's got some traction, but Baraki and I are basically just scheming on a bunch of articles that we're writing and going to do a podcast. So it might just be Barbell Medicine versus Donuts with the Doctor, even though I do like donuts. Yep, new website. The new supplements will be on the website. Yep. Have to... I do think a Donuts with a Doctor shirt would be fantastic. I mean, no one wants my face on a t-shirt, but I think you put donuts and something on a t-shirt. Apparently, you know, if donuts and deadlifts can be a company, then I think Donuts with the Doctor can work. Scott asks, best exercise and timing for grip strength, deadlift. And I don't say that in a way, like a way that I haven't considered other exercises. The deal is this: can you think of an exercise that loads the grip more than the deadlift? That's more and incorporates more muscle mass and over a longer range of motion. You can't find one, and so from a training economy standpoint, the deadlift wins. Okay. Now, if you have all the time in the world and you're a climber, and in addition to your climbing, you're gonna have to do some static holds. Okay. But for a novice, that's not terribly useful, especially if you're talking about grip strength as it pertains to the deadlift, which is what most people are talking about. So I do think that deadlifting helps build the grip. If you're having problems with grip, the best thing that I have found is on the final rep of your final work set for deadlifts, hold the barbell for 20 seconds. Okay? If you're not using chalk, make sure you're using chalk. If you don't have a gym that allows you to use chalk, get a new gym. And I don't say that again jokingly. It's like, look, if you're serious about training and you're at a place that doesn't let you use chalk, like I don't really know what to tell you. Like these are like first principles deals. You just got to find a new gym because they're not allowing any training to go on. And if you are using chalk and you haven't tried the alternate grip, I would try that. And hook grip. I did write an article about this on the Starting Strength website, so you should check out that article. Heather, you need methylated B. What do I recommend? I do not recommend taking methylated B. Yeah. I think that's into some areas that would require a lot of vetting by the folks promoting them. I do think that there are people promoting them, but not me. Well, if you're going to say something works, you got to prove it, right? Because the evidence so far doesn't really pan out. Could I put up a correlation to the amount of G-force that a rider takes during a race and then put up a number on it for what would be appropriate amount for a rider to be able to lift on the squat, deadlift, and bench press? Interesting. So, all right, so Mark is a professional motocross racer. We used to have him train. I think he's still doing that. So he averages 9 Gs on a lap. Wow. And so in the gym, like if you were squatting twice body weight, well, so gravity, I'm gonna have to do this math. I'm gonna have to do this math for the amount of, what's 9.81 meters per second squared is the acceleration due to gravity, and then if you're loading the system with, a twice body weight back squat, is that 2 times gravity? I don't know. That's interesting. And I think gravity may have to do, a G may have to do with acceleration or rotation. I'm unsure. I'm not I've taken a lot of physics, but that I don't know. That's above my pay grade. Let's see. So I'll have to get back to you on that, Mark. Craig asked, vitamin D supplementation beneficial? Yeah, I think so. I think, Michael Holick and his vitamin D solution, or vitamin D, the book, that's a pretty good book to read, a resource on vitamin D stuff. The interesting thing is almost every year, the amount that people are recommending supplementation has gone up. Most interesting thing to me from a vitamin D standpoint is that it does appear that low vitamin D is sort of a marker of something else going on, perhaps, including like depression and stuff like that, versus a cause. So even when you correct somebody's vitamin D levels, if you can, sometimes they're very resistant, it tends to not go away until the underlying pathology is an issue. Impacts of low vitamin D on the liver. I mean, offhand, the liver's involved in one of the hydroxylation steps, so you would say that if the liver is pickled or some problem with the liver, that your vitamin D levels are going to be a little lower. And I'm sure that there are a bevy of diseases that affect the liver that also are associated with low vitamin D levels. But I think most people should probably supplement. Thoughts on MTHFR gene issues? That is an interesting issue. I think that the naturopathic and chiropractic sort of field have overplayed how many people have those, or as Heather writes below, you don't digest or do appropriate methylation. I think that's kind of well, let's just leave that alone. How about that? Because I don't think that there is such thing as an MTHFR gene mutation. Certainly those who are homozygous for that or have the actual disease, it's a very serious issue, but most people do not. And the methylation stuff and the antioxidant stuff that's BS of the highest degree. Rosenberg asks, is 20 seconds useful if using a hook grip? Yeah, you can use both. I've actually done it for both, and I think it works well for both. Make sure you tape your thumbs if you're using hook grip. Main thing you got to do is you got to tape it when it's bent, because if you tape it straight, you won't be able to actually get the hook set. Do I recommend vitamin D supplementation? Yes, for most people I do. What is it, Velvet? I know, right? Thoughts on Cree-alkaline? Huge waste of money. That was easy. Yeah, we tried publishing a paper on creatine supplementation, how it affects serum creatinine, and Cree-alkaline will take your serum creatinine up to about 7 times its normal rate. It doesn't do anything because your urinary creatinine excretion goes up too, but yeah. You were going and check it. So Heather, if you've seen an actual medical doctor and they've told you that you're homozygous and you're getting supplementation and medication from them, then you should do that and not listen to me about people who are inappropriately supplementing with methylated stuff or thinking that they have an MTHFR mutation. Mark asks, do some people naturally have high AST and ALT counts? Yeah, so if you are, then don't ask me. I'm not, because your doctor's already worked that up. I don't have access to the information that they've had to make that decision. But do some people have naturally high AST and ALT counts? I assume that most of the standard laboratory levels we have are based on 70 kilogram males. And I assume that these are 70 kilogram white males, that they've derived these numbers from, versus having a wide variety of folks, different genetic and and ethnic backgrounds. So That being said, most people who train are going to have very high AST and ALT levels. It's a mitochondrial enzyme. It's going to be elevated for quite a while post-training. So that's why if you're going to go get blood work done and it has anything to do with insurance, you know, don't train for a few days, because a lot of things are going to be elevated, and then your doctor's going to freak out, you know, and so just don't train if you're going to go get routine blood work for anything, for like an insurance or life insurance thing or whatever. Just don't train for a few days beforehand. 3 or 4 days would be fine. All right. Have I ever worked out with anyone that have I ever? Yes, a pacemaker. Yep, I have. 48 hours, maybe more. Yeah, if you have to get mandatory blood work, I mean, honestly, I would get it on a Monday or Tuesday morning and not train for 72 hours prior to that. That's what I would do. Yep. The pacemaker is not a contraindication to training. So, yeah, Mark, so if you, the AST, ALT thing is interesting. So is the creatine thing. I would love to get a data set of men who are training and actively training, and then go get blood work, and then basically make a repository. Like, oh, if we have 200 individuals who have been doing starting strength who are similar, who post their blood work, you know, their de-identified blood work, and then we say, oh, here's the average AST, ALT range for otherwise healthy gentlemen who have no evidence, you know, other pathology, and here's their normal AST, ALT. I think that data set's useful. So that, because that gives clinicians sort of an idea like, oh, this is normal or abnormal. Because if you came into my office and your AST and ALT are slightly elevated, I don't really know what to make of that, you know. And so that's why most doctors would be like, well, hey, come back in a week or two, stop doing whatever you're doing, stop taking drugs or whatever you're taking, and then retest you. Because we're like, does he have hepatitis? Does he have, you know, some autoimmune issue? Does he, you know, is there an infection? You know, like mono or, you know, something like that. So, yeah. Let's see. When is it appropriate to continue training postpartum? I mean, you should like deliver first and then, you know, get discharged from the hospital. And then you should, you know, you can train, you know, I'm not going to give you days, but in reality, this is going to be more based on how you feel versus anything I tell you. It also depends, you know, did you have a C-section? Do you have sutures in place? Did you have a laceration? Stuff like that. Let's see. Danny Davis asks, what are my thoughts on testosterone therapy in 40 to 50 lifters who have no obvious symptoms? Yeah, I mean, I think it's reasonable. I mean, it's a quality of life thing, right? So symptoms, there's a lot of these things are subjective, you know, and then you get an objective measurement by measuring someone's testosterone, and then you make the decision, you know, is their quality of life likely to benefit greater than the risks? And it's just a discussion to have. I think, you know, and I would absolutely not speak for all clinicians or doctors or residents about testosterone replacement, but it does seem to be that people are very, very hesitant. And I think if you put a gun to my head, I would say that I think most of the risks are overstated when looked at broadly, and, you know, each individual is going to be a little different, and there are a lot of methodology problems with some of the studies that have been done. We just have such an issue with it in our country, and I could go on a tangent on gender and hormone replacement therapy and you know, PEDs and stuff like that. It's just, I think we're only here for a certain amount of time, and if it negatively affects your quality of life, then despite a normal number, then maybe it's reasonable to treat. So yeah, kind of nuanced. I know, heretic, right? Hang me. All right, so we'll do one more question. The next question I get, if it's a good one, I'll answer. Otherwise, we'll shut it down. If you're on the Google Hangout, if you're friends with me on Facebook, and you should be able to check this out, because I think I was told the whole reason I did this is because Facebook saves it. So this will live forever until the end of the internet. So we'll do one more question. Ooh, we're gonna wait. All right. My dad, of course, with the last question. My pick for Anaheim too. All right, so look, if y'all like motorsports, which you should, you should watch Supercross this Saturday. Anaheim 2. I'm gonna pick Kenny Roczen. It's tough to beat. I'm gonna pick Ken Roczen, and I'm gonna say my wild card pick is gonna be for the 250 class, and Austin Faulkner. Novice progression for a nurse. Do it. No different. Look, if I can get stronger being a doctor, they can get stronger being a nurse, right? I heard the Chargers are coming to LA, and I'm not really a Rams fan. I haven't been since 2001, greatest show on turf. Hello, but now that they're out here, I have to be a Rams fan. And with the Chargers here, I don't know. I'm conflicted. I don't know. I don't know what to do. Also, just for the record, I am not a huge sports fan. I love athletics. I love learning about the sport. I love the training. I love all that stuff. But to go to a football game, I'm not going to watch. I would never watch every single game of a team playoff season. I would go to a game, but I would never watch ever on TV. I couldn't do it. I don't know what the deal is. It's weird, right? I know. You guys all lost so much respect for me. Don't be a Rams fan. The NFL sucks anyway. Yeah, well, Matt, you make a good point. I was, yeah. I don't know. I can't. It's not for me. Track and field I like a lot. Weightlifting I could watch the whole 58 kilo B session. But so I'm bringing the ratings up for weightlifting when I watch, but I can't do it for football. Okay. Hey, thanks for tuning in. See you guys next time. Scott, I'm ordering them. They come out on the 21st, and then I'll let you know about the new Romelios. Folks, thanks for tuning in. See you next time.